And we welcome to the show nurse navigator Melody Sonnenberg and clinical educator Shelby Eicher. Nice to see you. Welcome.
Nice.
Thank you.
And I'm glad to see you're dressed in the colors of the week, Valentine's Day,
Yep.
Heart Month. Big concern. Our heart.
Yes.
It's really it's our most important organ,
It
isn't it?
is.
It is.
You
Yes.
don't have one of those, it's bad.
And yesterday, or was it Monday? I think it was Monday. When was Doc here? Monday. He said heart disease is the #1 killer in this country.
It is.
It is.
Yeah. So you guys, heart failure is our topic today, and you work with families and patients experiencing heart failure.
Yes.
You have support
Yeah.
group?
So I work at the heart failure clinic. So we have a specialty clinic that just deals with people with heart failure. And so we wanted to reach out to the community and try to get more people involved. We would like to keep them educated and try to keep them out of the hospital as much as possible. A lot of them will readmit once they are sick and in the hospital. So getting good education is going to be important for them to live a better life and stay out of the hospital.
Well, let's talk about what is heart failure first, because if you hear the term heart failure, you think, well, that's it. You know, lights out. Is it?
So no.
No.
So heart failure is basically the inability for the heart to push that blood around the body as much. And so what happens is that heart gets stiff or if it gets weak. And so that blood can't be forced out of the heart as well as it should. And because of that, fluid will back up and it backs up into your blood vessels, and that fluid then goes into your tissue and it causes a backup of fluid in the tissue, and that's how you get all that swelling.
So
It's-
heart failure, it's heart failing.
Yes, it's just a push problem or a stiffness problem usually, but it doesn't mean that your heart is ever going to stop. It's usually because of heart disease that is the major cause of that.
Still working, but
Still working, just weakened.
yeah. Congestive heart failure, is that different?
It's the same.
Same thing.
Something. Yep.
What's a clinical educator? What do you do in your job?
So we actually have a team of patient educators that I work with, and we go and see patients in the hospital and do education. My specialty is heart failure, but we have diabetes educators, COPD, stroke, and sepsis.
And a navigator, are you the one that kind of guides the patient through their...
I guide the patient through the outpatient area. That's kind of what we do is,
What are some of the challenges for people living with heart failure?
Well, some challenges that they deal with once they are out of the hospital, I think a lot of it is the emotional and physical effects of it.
Well, it's a bad word. I mean, when you tell someone
yes,
you've got heart
it's-
failure,
it can be
it's
scary.
Yeah, it's scary.
I think it's very isolating a lot of times. People aren't able to get out of their house because they have trouble breathing because of the extra fluid on board. And they also have to depend on other people to help them. And especially when they're very self-sufficient through their whole life, all of a sudden they feel like they're a burden. And so hopefully this is what that support group can help, is kind of have them all get together and kind of learn their shared experiences and realize that they're really not a burden.
My mom had that diagnosis and she did not want to leave the house.
Yes.
And you know, we really never knew, you know, for sure why, but it was difficulty getting around, breathing and so on. But I think that just that having that diagnosis, it just was, I guess, the safe, she felt safe just staying at home.
Yeah.
And it's very hard, so it makes them more depressed, and so it's, and then a lot of them do have other problems like getting medicines, and then they're on a whole bunch of diuretics which make them pee a lot, so they don't get out of the house very much because they have to always have a bathroom available.
So you guys have a support group for people with heart failure. Is it for just the patient or with the families too?
It can be for anybody, family, anybody who wants to come, really. I think a lot of the families can use support just as much as the patient themselves in navigating through this disease. process.
So how does it help? What are some of the things that might occur during it? It's an in-person
Yes.
group meeting?
Yeah.
What happens there?
I think that hopefully people get together and alleviate some of the depression and the loneliness and kind of understand the disease from a different point of view from everyone that's there. But we're also going to have speakers there that are going to talk about medications, and they're going to talk about exercise and other things that they can do to help their heart as well. So hopefully we can, give them a little bit of education. It has proven very effective in people living longer lives if they're well educated about heart failure.
So are the causes of heart failure related to lifestyle? So do people feel maybe it's their fault that they have heart failure because they didn't exercise or didn't eat right or they smoked? No?
No, it's no one's fault really. Diet always plays a part. Genetics play a part. There's a whole bunch of different factors that have people get heart failure, or be diagnosed with heart failure. It's a syndrome, so it's caused by something else usually, and it's not anyone's fault from whatever they did. It just will happen.
And you're both nurses, so you know the disease. Is it chronic? Is it manageable, or is does it end up always being fatal?
You can manage it.
Yeah.
You can manage it.
It is a chronic disease. It does get worse over time. There are things that they can do to help, and most of those are take your medicine, try to stay away from salt, try to watch your fluids. We do have a doctor that comes from Detroit once to twice a month. Her name is Dr. Grafton. She's wonderful, and she actually works on the heart transplant team there and does LVADs, which are small pumps that go into the left ventricle that push that blood around the body. And we've had very good success with that. Usually that's a younger person. There are limitations to that, but yes, it is a chronic disease, and just trying to stay as healthy as possible is going to help you stay.
So the people in your support group, they wouldn't be candidates for heart transplant?
Yeah.
It can be anybody.
They can be? Oh, they could be.
Yeah.
So is there anything common besides having heart disease? Is there a common age? Are they all seniors or?
It really depends on what's going on in their life. We have very younger people. We've had people that have had problems because of pregnancy that have gone into heart failure.
Really?
We have other people that are younger that have may had an early heart attack or another problem with heart disease or a congenital defect. But a lot of our patients are older. Yeah.
What do the family members get out of the support group? How are they helped?
I think to just help support whoever has it in their family. Just because, we have patients watch their fluid and their sodium, especially if there's a caregiver that's making the food for them, how they can make food to limit the amount of sodium they're getting, watching their fluid intake, making sure they're staying up on their medications and helping them with activity, because activity is so important too with heart health. So I think it can offer a lot for them.
Do people see this coming?
Not always, and
No.
sometimes the first time they realize they have heart failure is when they're in the hospital, and they've gained a lot of weight very quickly, and that's one of the major signs. It's
They gain weight quickly?
yeah, because it's a fluid thing, so they have fluid in their blood vessels as well as fluid in their tissues, adds extra weight, and so when they do that, they just think they have a cold a lot of times or pneumonia, and they'll come in and they'll have too much fluid on board because their heart just isn't pushing as well as it should.
Well, that'd be another reason why somebody would be really depressed about it, because they're gaining weight and
Yes.
they're not.
Yes.
Yeah. So is there a lot of? It's emotional. There's a lot of emotional.
Oh, yes.
It's very
mental
emotional.
health support.
Yeah.
Yeah. When do you meet? Is it monthly group?
Monthly group. Yep. It's the third Tuesday.
Yep.
Third Tuesday, from 3 to 4 is the time we decided on.
Yep.
We just started last month, so we're hoping to kind of get it rolling and getting more people to show up and getting it out there. That way people know it's out there to come
Yeah.
to. So.
And it's at the Y, so it's just down
Yeah.
the road.
Your brand new space over there.
Yes,
Yeah.
our beautiful space. It's
Very
very
beautiful.
nice. Yeah.
Well, that's got to be, just having it at the Y, that's got to be a,
Mm-hmm.
Yes.
you know,
Yeah.
a day brightener for people.
Mhm.
That's maybe they can go upstairs and walk or something too
Yeah.
while they're there.
Yeah.
Yeah.
And I think it'd also be great just having community members that are all going through the same thing to get together and to, you know, discuss how they live their life and just having that connection with other people in the community too.
They might see someone they know. I didn't know
Yes.
you had heart failure. I didn't
Yeah.
know you had heart failure.
Yep.
Right,
Yep.
great.
A lot of people have it, and a lot of people don't know. So.
Yep.
Do you have to pre-register for the group?
Nope.
Nope.
Just come on in.
Nice. And it's what? How long? An hour?
Yeah,
About
but
an hour, yes.
When's the next one?
It's on the Tuesday, the 17th of February, at 3 to 4 p.m. at the Y.
Very good. And people can find out more on the Henry Ford website
Mhm.
and in social media.
Mhm. Yes.
Yes.
Yeah, you guys have a lot going on during Heart Month.
Yeah.
Yeah.
Well, thanks for all the great care you provide our community.
Thank
And
you.
thanks for being on Wellness Wednesday today.
Thank
Thanks
you
for
very
having
much.
us. Yeah.
Our Wellness Wednesday guests, working with Heart Failure Support Group at the Jackson YMCA, clinical educator Shelby Eicher and nurse navigator Melody Sonnenberg. Up next, we've got a pet of the week that is, Brandon, this can't be right, an armadillo.